fork?
Okay, let's try this again. Welcome to Forking Off, the podcast for people who said no to just following orders, where we explore the very personal decisions behind leaving federal service, whether by choice or by force. Every departure has a story, and we're here to share them.
Hi, and welcome to this episode of Forking Off. I'm Jill Fields,
And I'm Philip Fields.
and today we have with us Dr. Anna Mitchell of Anna Fired Fed. Hi, Anna.
Yay. Hi. Thank you both so much for having me on.
Oh, we're so excited to have you and to hear all about your story. So, why don't we go ahead and get started and give us your bluff, your bottom line up front?
Awesome. Well, yes, I'm Anna Mitchell. I've now reinvented myself as Anna Fired Fed. I was at the CDC in the Chronic Disease Center. I served as a project officer, public health advisor on a team for social determinants of health. And I was part of the April 1st RIF, or reduction in force, that took place at HHS. I was one of 10,000 who lost their job that day.
Wow, that's 10,000.
That's so many people.
I can't even.
On April Fool's Day, nonetheless.
Yeah, I was about to say that just doesn't seem right in so many ways. Oh my gosh. Let's go away from the terrible real quick. Tell us a little bit more about you and how you got into public service, because I know you were in the Presidential Management Fellowship program. I'm like, there's so many words there.
I know, us and our acronyms, being in the federal service. Yes, I was in PMF, or I was a Presidential Management Fellow. And even though it's called a fellowship, we were full-time employees. And so I was at CDC for 2 years, and I was honestly widely involved at the agency in that short amount of time, and even beyond the agency, just being a PMF. I will say that the job that I had at CDC was truly my dream job. I feel like I manifested it. When I was at the halfway point through my PhD, I would read very frequently the job that I was working towards and my why, which was very much in working in public health at a systems level to help address systemic barriers to health equity. And I worked on a team, again, for social determinants of health, which are essentially other factors that impact people's health, like the built environment, food environment, community and clinical linkages. There's so many things that, again, impact our health that we don't really think about. It's beyond personal choice. And again, really the environments in which we live, work, and play. And so, loved my job. Being with PMF, being that it's a leadership development program, I really did see my future in federal service and in federal leadership. In losing my job, it wasn't, I guess, just losing the job in the moment, but really kind of like the dream and vision that I had for my life. But during those 2 years, I also, at CDC, I was involved in Unidos, which was our Hispanic and Latino employee organization. I was the vice chair, and this was a volunteer opportunity, so something that I did on my own time. But we were an organization really working on building community and increasing awareness of Hispanic and Latinos at the agency, because we only made up 3 to 5% of the workforce at CDC, with those numbers being stagnant for about 20 years. So we have about 19% almost.
Yeah, that's what I was thinking. Wow.
Yeah, that was, that was honestly also a huge passion project of mine. I helped plan the Hispanic Heritage Month events, which it is currently Hispanic Heritage Month. And this actually led to my PMF rotation opportunity. So for a short time before the administration change, I worked with Francisco Ruiz, who was the director of the Office of HIV and AIDS out of the White House. And then I ended up pivoting and did some work in change management to finish my PMF rotation. And I was actually in my rotation when I lost my job. But again, it was an incredible 2 years. I think the culture at CDC was everything I could have asked for, as far as, people being very passionate about the work they do. It was a really great balance of science and community. And I loved it.
It's so hard to hear when people say, this really was my dream job. This is what I really wanted to do. And I could see the impact I was making. I know you were making an impact. Did they give any reasons for why they were cutting your program specifically, or your department? Were you told anything other than just, hi, happy April Fools, it's your last day?
Yeah, they actually eliminated my entire division. So I was in the division of population health. So again, we were within the Chronic Disease Center. So it wasn't just, my team or my branch. It was actually all of us.
The whole division?
Yeah. We were all,
So
eliminated.
we just don't care about population health anymore. is what I'm hearing.
Oh, yeah. And not just that,
God.
but for example, like healthy aging was one of the branches. So I talked with somebody at NIH and they were like, yeah, we no longer have any contact at CDC that works in like Alzheimer's or dementia, for example. Like all those people got
Whoa.
scrapped in my division. Yeah.
No words.
Yeah, I'm speechless. This keeps
Not-
happening too. Like,
Yeah, and Philip is not usually speechless. He usually has something to say. So
Yeah. So not that we have, an aging population and, yeah, of course, Alzheimer's and dementia. I mean, CDC is working in prevention, in awareness and all of that. And so just to have it happening at NIH, I just feel like NIH is obviously very research focused. I think actually rolling out public health measures is what CDC is supposed to do, and to not have that in a lot of, again, very important, not just healthy aging, but we lost healthy tribes. And then a big part of my division also was doing surveillance tracking and monitoring, which, if we don't have data, then we don't know what health problems actually exist, what disparities lie. And it just makes directing funding in an efficient, effective way very difficult if, again, we don't have data. The cutting of surveillance programs was scary.
can you explain surveillance and tracking? Because for us, surveillance and tracking is a very different thing than what your version of surveillance and tracking would be at the CDC.
Yeah. And I mean, disclaimer, I didn't do this directly, but essentially there were surveys that people would take that would give us indicators of population health, or potentially your local, public health department would track information. So one area that was cut at CDC, this was not in my division, but they made a lot of deep cuts to the division of reproductive health. And they actually cut the PRAM, which is like pregnancy risk assessment monitoring system. So they cut the people and the system that tracked mother and infant mortality and health associated issues. And the US is actually we have the highest rate of mother mortality than any other high income country. And so, for example, that system, those people, that team is gone. And we used to have national coordination to track this data so that we could work to improve that, keep mothers and infants healthy and safe. And yeah, that data is no longer being collected. And those were some of the many very crucial cuts made on that April 1st day. And I think what is important to note is they did, as we hung in the balance, because we got cut, we thought we were losing our jobs. Some people did get hired back. Some people are still being protected under a court case. And then some, like myself, eventually, did officially lose our job. With most losing their job, only few got hired back and very few are still protected. So
I heard you mention earlier they also cut a program called Tribal Health.
yeah, or Healthy Tribes. So that was a full branch doing work with tribal nations across the US, mostly based in Albuquerque, New Mexico.
And this would have been, I guess, doing outreach with them or providing health services.
Yeah, most of CDC funding, about half, goes directly to state and local public health departments or universities. Like it goes out to communities. And so for example, Healthy Tribes directly gave money to tribal nations to put on health programs, working in prevention of chronic disease in our case, trying to improve health disparities. And so that entire branch was cut, and they were, administering those funds, and making sure that what was being implemented was evidence-based and collecting data as well on where that funding was going and what kind of impact they were having to, help out different tribes across the US.
Wow, yeah, that's really sad. I grew up in Oklahoma. Most of my family members got their health care through the Cherokee Nation. Yeah, I can't imagine, like I have family members now who get their healthcare that way, and so that sounds like that's probably taking away from programs that they're relying on. That's really disappointing.
Yeah, and not just that, but like federal cuts that happen, through CDC. Some public health departments, half their budget, local public health departments, like half their budget comes from CDC grants. And so if that funding gets cut, I mean, the programs for the community just aren't there, not to mention the staff. I remember this was published that reported that blue states that actually sued against these funding cuts got their funding back, and a lot of red states did not sue, and therefore that funding did get cut, or it still hasn't been returned. I'm sure that, again, the impacts are widely felt and also vary depending on where people reside.
That hits we didn't know about that part. And a lot of people aren't going to know about these things. So thank you so much for sharing this. So moving on to the next question that I would ask, and I will ask it, but it's not really gonna have an answer because is there anything that would have changed your mind? But you didn't even get a choice.
Yeah. Yes, I would have kept, I would have loved to keep my job. I would love to be working right now. And yeah, it was definitely, again, I don't think there's many things that could have caused me to have left that position. Potentially if I had been reassigned to other work that, was directly not in alignment with my values or was having me cause harm in some ways, I think I would have quit. But otherwise, yeah, I loved my job. And I think one thing that a lot of people aren't aware of is it's not just, feds losing their job. It's also the way in which it was done. And so, I lost my job officially on a Monday and I found out on Thursday that my job was officially over, which is also just like a weird, when I got my final, again, decision letter, it was dated to Monday, but I received it on a Thursday as well as the email on a Thursday. And so we're finding everything out via the media that like, oh, it looks like CDC employees might have lost their jobs. And then finding out days later, it was just caused a lot of chaos and made it all that much harder.
That seems potentially problematic to fire someone and let them continue coming to work for 3 or 4 days afterwards too. Like, that's just terrible business practices.
Yeah. Well, we were technically on paid administrative leave during this time, but I don't understand how if you making a decision on a Monday and we're planning for this decision, how we can't just at least send the email to electronically alert people, because the decision had been made to the point where media knew, but staff didn't know. And I think this has been a kind of a reoccurring theme amongst this current administration, and especially with what's happening at CDC is a lot of times, and actually, we got an email from the agency, I think on the Tuesday, saying, we don't know what's going on. We have had no communication. Yeah, again, reports were just being made in the media. Not even our own agency were aware of if we had actually lost our jobs. So, yeah.
I think lack of communication has been a big one that we've experienced, but we've also heard from a lot of other people as well. It's been wild. And, one of the plugs that was made for the efficiencies, I'm doing air quotes right now, was that, they were going to be able to better communicate with the workforce through all of this. That's why they were allowed to just bring in their email servers at OPM. And then they only used it for the things that they thought were beneficial to them, which is another theme.
Mm-hmm. Yeah.
Anna, you have been doing a lot since you left your government service. What have you been doing?
Yeah. So when I first found out, I found out I was losing my job in April, but I actually had 5 months of paid administrative leave, which was a nice transition out. At first it was a lot of grief, and I honestly had been in quite a bit of fight or flight since the inauguration. And so I think I needed about a month to just try to get myself regulated again and get my life in order, because I wasn't really taking the best care of myself. Again, after inauguration to the time when I lost my job, I feel like I was just in this constant state of stress and grief as I had piece by piece of my position and the organizations that the work that I did, on a volunteer basis. For example, with that employee organization, things get stripped away, or colleagues that I had being placed on administrative leave for their former work in DEI or whatnot. So it was, it took a month to kind of get my life back organized and start taking better care of myself. And then I spent about a month traveling in Spain, which this was a trip taken also in an effort to be okay, I need to get out of fight or flight, regulate myself, have perspective on the world, which is really what prompted the trip. And it was actually when I left on the trip that this kind of next chapter began as well, where one of my friends had pushed me to start sharing information on social media, mostly just about my life. They wanted me to start a TikTok. I had never had a TikTok, but long story short, that turned into advocacy very shortly after, still being very connected with my former colleagues. Yeah, once I came back from my trip in Spain, I actually attended a congressional briefing in DC, which it was a training already paid for. There was nothing I could do to cancel my registration or have the agency refunded. And so I self-funded my travel to attend that for a week, which was really informative. And again, it was through Georgetown University but just again, showing like, this is what I loved what I did. And so I wanted the knowledge. So I still went.
I love
Yeah.
that. You loved this, and it shows that you loved this so much.
So I figured, why not? Yeah, since then, that was in June. And since July, I've pretty much been working full time on my pivot.
Well, tell us about that. Tell us about Anna Fired Fed and everything that you're building right now.
My reinvention, which again, this comes after months of the anxiety and grief that went with kind of losing that farmer chapter, as I've mentioned. But yeah, I've decided to fully embrace the pivot, reinvent myself. And the reinvention is kind of like fired, fed to civic coach, is what I say. And to speak it into existence, I truly am trying to, or I'm going to start a social movement, a cultural revolution, if you will, to make civic engagement part of people's everyday life. I really want to make this a lifestyle, just like fitness is a lifestyle. I'm thinking about how I can rebrand civic engagement as civic fitness, because I myself realized that I was able to turn my despair into action. And then once I did, I started to have a lot more agency over my life again. Yeah, it gave me hope. And I believe that if more people took civic actions on a consistent basis, we would build more community, strengthen our democracy, and honestly help people improve their mental health in a time where a lot of us feel very helpless and hopeless and scared, to be honest.
Yes, those are the words. Those are the words that I use quite a bit. I feel hopeless. So I'm scared. I don't know what we're doing. And
Yeah.
Philip listens to me. So Philip, see, I'm not the only one.
No, I know you're not. I love the idea of like civic fitness, and like I haven't been fit in a while now. I got out of the Marine Corps a long time ago, but with fitness, like part of staying in shape, right, is doing something every day. So like, do you have any suggestions, or like what do you think about like what are things that people can be doing every day to get more civically fit?
Yeah, I love that. I'm going to share. And I think a lot of times people initially are kind of like, what, like, how is this going to make a difference? Because I think a lot of us really want a silver bullet. And it's obviously too, like in a fitness journey, like if people are like, I want to get fit like tomorrow, like I want the results, everybody wants, those big results, but that's not how I feel like anything works. I feel like it's consistent, small action taken over time. And I think if everybody took these small actions on a consistent basis, again, we're going to be building hope, improving our mental health, and improving our communities. And so I think there's different levels. So this will also play into my civically fit idea for like beginner, intermediate, and advanced, because, not everybody, if they're like, I want to do something for my health every day, not everybody can go outside and just run, 5 miles or whatever. Some people might just be like going on a walk, 20 minutes a day, or whatnot. So again, there's different levels I just want to mention, but I think there's really simple ways that, again, can fit into everybody's lifestyle, even those busy folks, people with families. And so some examples would be, I think a lot of people are consuming information on social media via doom scrolling, as they call it. And there is really something called practicing digital resistance, because what happens with social media, and I know that this is problematic, is like these information bubbles that get formed. And again, I am a big proponent that sharing information on social media is actually way more important and impactful than people think. So one thing that people could do is if they see some sort of news that they feel passionate about or that's impacting them, like we have to raise awareness, because one example is there's a lot of harmful things right now happening to immigrant communities, but I only see my other Latina friends like posting about that and raising awareness. Like I don't see a lot of my other friends. And I actually asked my cousin once, who's like very active on socials, she posts on her story a lot. And I was like, hey, why don't you ever share anything? I'm just curious, like politically, what's going on? And she was like, oh, I never see that content. I only see workout videos and, again, cooking videos, because that's all that she consumes. And so if you are that person that shares one thing that's, of importance to you on your story, and you might expose somebody for the first time that they're being exposed to something that's going on in our larger environment. And when you see somebody that you care or respect or love share something, you're more likely to take a second glance. Because I do think that there are a lot of us that are very aware of what's going on, but there's also a lot of us that aren't or a lot of people that aren't paying attention, and people are getting their news from social media and podcasts. Like that's just the reality. Quickly to answer your question, otherwise, like beyond digital resistance, I think even, for example, people choosing how they're going to spend their dollar getting a coffee. You could support a local mom and pop shop in your community. And we know that a larger percentage of your dollar, if you're invested in community businesses, stays in your community versus like grabbing a Starbucks. Very basic example. I started like doing volunteering with an organization that's every Monday night. So it's 2 hours, 6 to 8 every Monday. And that's literally enough to fill my cup that could last for the week. But I'm also usually attending, community events and doing other things. But, calling your Congress members and representatives or sending emails using, like the 5 Calls app or Resist bot. It takes less than 5 minutes. And those are things to be like, well, I'm not just at least reading it. I'm going to let my reps know that this is something I care about. So nothing groundbreaking, but again, there's different levels depending on where people are in their civically fit journey, how much time they have, and what exactly, their like passions and interests are.
That is awesome. I know I've spent a ton of my career sort of dealing with the negative sides of influence on social media and propaganda and radicalization. And what you just described is, I think, one of the most effective ways to counter that. And that is to get out the positive messages as well. And so many people, Jill and I have been complaining about algorithms a lot lately and the way that social media works. I'm a big fan of Blue Sky personally because they try and get past that. So many people consume and don't share, and it stops when you do that. Like the message stops with you, and if it's something that you think other people could get value from, even reposting things can make sure that message goes a little bit farther and raise awareness about important topics.
Yeah, even liking and commenting, then that puts that information like higher in people's feed. There's all of those metrics. I mean, they do matter. And so at least if you're reading something, do the due diligence of liking it or even commenting. And if you don't know what to comment, like even adding an emoji, even if it's just a broken heart or maybe, that still counts. That will still, again, help boost and spread the information. Because the bare minimum, the first step of getting people engaged is awareness. Just like on a fitness journey, like nobody's going to make lifestyle changes to eat healthier or get fit if they're not even aware that that's something they should be doing or that there's a problem or that, they need to improve their health. That's why they might go to the doctor and then get their blood work back. And then that awareness of like, oh, actually my cholesterol is high. I might have to start doing XYZ. But if they're not aware, they're not going to be doing anything or making any changes. So awareness is the first rung on the engagement ladder. And I think a lot of people don't realize that and, or are looking for a silver bullet when really the solution is going to be 1,000 tiny BBs, or as I say, probably 1,000,000. But like truly, it's the power of small actions that will build community. No one is coming to save us. Is my hot take.
No, people don't realize.
We know that.
Yeah, but you're right. People don't realize the power that they have right at their fingertips. I was talking with a friend the other day about what we're doing, and he was like, "So are you paying influencers to promote it for you?" And because he wanted it to get out, but he was like, if this is 2025, if you're not hiring influencers to do promotion, then it's not going to go anywhere. And, went into this whole long argument between us about how there are no grassroots movements anymore. It's all astroturfing. And it's just really disappointing. But I think you're absolutely right. I think that when people realize that they're how information proliferates, that's a lot of power.
And honestly, because of my as well, awareness. And I think people who have personal brands on social media start to gain so much power. I mean, I don't even want to mention it, but a few weeks back when there was the assassination, publicly, the kind of power that person had started, I mean, truly a movement. And that is through sharing information on social media. People build a personal brand, and that's how misinformation spreads too. Somebody, even again, I'm coming from a science background. So so much misinformation on vaccines. Somebody's a wellness influencer. People like them. They're invested in that person. And then that person starts to say, I don't think I'm going to vaccinate my kids because XYZ. And then, again, people trust them, parasocial relationship develops, and other people will start to adopt similar points of view or lifestyle habits. And I'm literally wanting to do the same, but for good. as far as trying to be a voice, but it's really to just get people to start getting more involved in their community and honestly too building empathy, which I think will come through more involvement in the community, because less individualism and more community is kind of like really where this push is coming from. But I'm trying to use social media as a tool to get there and again meet the people where they're at, which is truly online.
That's very cool. I will say, after we talked to you about a week or so ago, I was like, gosh, I've been home for this whole time and I haven't, like, normally I like to have something to be involved in, and I just haven't, because I think since we moved back to LA a couple of years ago, I've just been so drained. But after we talked with you, I like got online to look and see, okay, well, what can I do? So like tomorrow I'm going to the West Side Food Bank and I'm going to be helping with the packing of the boxes there. I was like, well, that's not much, but it's something I can do. And then we've got in Santa Monica, we have Heal the Bay. They have a volunteer orientation. I'll be going to that next week and try and get Philip to go too.
I think it's great. I love Heal the Bay. So
I mean, just that one conversation with you, like that spurred me to say, hey, I need to rethink that. I need to think about what I'm doing. So I thank you and just say like, hey, there is an impact. You're having an impact. So I love that. So what's next?
Yeah. So the big plan and actually is to start rolling out my ideas more. I've took to social media initially just advocating for feds who felt very voiceless, because once I lost my job, I was like, well, at least, now I have my voice. And so that's what I started doing right away. But I didn't want to just always share news and current events. I still want to keep that as like something that I do to help out feds, but I really want to, again, roll out this idea of civic fitness and helping people get engaged. And so with that, I am hoping to take advantage of those New Year's resolution vibes, where people want to, make a change in their life. And usually it's around fitness, but maybe people will make a civically fit goal. And I'm going to work on some ebooks and action guides to help people get civically fit. If they want to do politically focused things, if they want to do community focused work, again, it doesn't have to always be political. And that's kind of my big push to pilot this all in January, February. And then I even want to create an app at some point or pay somebody to create an app that will help track civic fitness. So we'll see. Who knows? I actually I'm not exactly sure how this is all going to develop, but basically I am actively taking steps every day to kind of pivot into this new like entrepreneurship opportunity. So those are the immediate next steps, is trying to get people civically fit, quote unquote, starting now and in the new year. And then definitely for midterms, potentially with guides like Couch to Community, thinking about like Couch to 5K or something like that as well. I think a lot of people, well, actually, Jill, what you mentioned about you now, volunteering with the food bank and the other community event there, it's just like fitness where you feel tired and drained and you don't have any energy to work out, but then you take a walk outside and you come back feeling more energized and just like happier. And it's the same thing with volunteering. I feel like you might feel like you don't have time or have the energy, but you come back again feeling like your cup is filled. I'm really just hoping to spread that message and get people involved.
Well, I got really excited when you said build an app.
Oh,
I mean, I'm not probably the person that you want, but I have done some of that before. If you need any help, like finding people and figuring out whether or not they know what they're talking about, I'd be happy to help you figure out how to get that going.
I would, love that, because that's the thing. I think so this behavior change framework, really quick, it's called ADCAR. It's actually for organizational change, but their motto is that or organizational change happens one person at a time. And if we're thinking of like the society too as like an organization, I agree, like one person at a time. But the acronym is called ADCAR, which stands for awareness, desire, knowledge, ability, and reinforcement. And I feel like a lot of people have the awareness and desire to do something. Those are like the millions of people that went to No Kings or doom scroll every night being like, what's happening? But they might lack that knowledge, ability, reinforcement to actually take action. And so I really want to help with those three last pillars. And I think that knowledge and ability is information I can spread on social media or through digital products like the ebooks or action guides. But I think reinforcement would be so crucial. And I think an app that would track civic fitness, at CDC, we would say what doesn't get measured doesn't get managed. And I get my 10,000 steps every day because I have a fitness tracker that counts it. And I think there could be real value there in helping people track their civic engagement, create civic circles and see, have a family goal or a friend group goal for the month, the week, and help, even do challenges just like you can do on Peloton, or there's so many opportunities. Yeah, I think to, again, make it a lifestyle and not just a one-off, I'm going to vote every 4 years, or I'm going to, attend the occasional protest. I think there's more we can all do.
Yeah, and like for anybody who's ever like taken part in any sort of like community event, it's always a little awkward the first time when you show up and you don't know anybody and you're not sure what the protocol is and where do I go. And like something like this, I could also see sort of easing somebody into that before they show up the first day. If you find the community here and like, maybe you connect with some people or bring your friends along with you through it, like that ensures that you're going to be more successful once you're involved.
100%. And I think, again, when you take this action, not only are you meeting like your own psychological needs for agency and meaning and purpose, but when you do it with friends, then you're bringing that other need for like connection and belonging. And yeah, I just think the possibilities and the impact is endless.
Yeah, I'm excited to see where that goes. That's a great idea.
Thanks. I appreciate that. And this idea flooded in my mind actually the day after I lost my job. It was April 2nd. I was unloading the dishwasher and all of this I literally wrote it on like a random piece of mail, which somebody was like, oh, do you still have that? And I'm honestly need to look. I might. I think I'd just like to say, if you're a fellow Fed, or you care about a Fed, or you care about what's going on right now, or again, at all, you're feeling hopeless, despair, that I really do believe that we will have a brighter future. And I know that because so many people care that we'll get there. If we all take action, I think things might get worse before they get better, but I really do think they're going to get better. So if anybody feels inspired to follow along on a Fired Fed, I would love to do anything and everything I can to, help you get involved or spread awareness as well.
Well, we should have put the links in the show notes for your Insta and your TikTok. So one last question. If given the option, would you go back?
Ooh. I know. Well, now that I just talked about my idea for my reinvention, I feel very excited and my gut is like, no, I want to pursue this. But I think actually if I would have been offered my job back, like, other people who got riffed in my same time, they were offered their job back. Truly, I think I would have taken it. I mean, I know I would have. I loved it. I mean, it wasn't the job that I had December 2024, but I do think that I would have taken it back, at least, for the time being. I don't know. As much as I want to be brave and say I wouldn't have, but
no, there's no right or wrong answer.
Yeah.
There is no right or wrong answer.
I think it was after, again, getting excited about my idea that I was like, oh no, I don't want to go back. But no, truly, I think I've thought about that. And I think, I would have gone back.
Oh, well, I love that. And I love your optimism and I love everything that you're doing. And we're so thankful that we have gotten to meet you. And thank you for sharing with our listeners. And thank you for forking off.
Thank you both for having me. And it's truly been a pleasure.
Thanks for tuning in to this episode of Forking Off. To our listeners still in government, remember, your integrity is worth more than your TSP. Leaving doesn't mean giving up on public service. It just means finding new ways to serve.
Until next time,
keep your ethics,
keep your dignity,
and we'll keep telling these stories.
If you're a former Fed with a story to tell, or you're wrestling with your own ethical crossroads, reach out to us at info@forkingoff.com.
Today's episode was created, produced, and edited by Jill and Philip Fields. Special thanks to our guest, Dr. Anna Mitchell. You can find more information about this episode at forkingoff.com. Follow us on Instagram, TikTok, Blue Sky, Mastodon, LinkedIn, or wherever you get your podcasts.
Join us Monday, October 27th, as we sit down with former DOJ employee Patty Hartman.
There were a number of reporters who asked me after the election, are you going to stay? And I said, that's my plan. Doesn't matter to me who's in the White House because there's a separation. My job does not depend on who is in the White House. That line between the White House and DOJ had been obliterated pretty early in 2025. It didn't matter that there should be a separation. There was not going to be. If you have a politician telling you who to charge, which is what's happening, there is no integrity in the system. That's not real justice. You can't prosecute people based on whether or not you like them. We are really on the verge of becoming Russia right now. And that sounds like hyperbole, but sadly, you have to look at it through the lens of reality in order to understand just how true it is.
Don't miss a special episode Thursday, October 23rd.
as we celebrate the grand opening of GOAT Sports Cards with former Pentagon police officer Brian Janik.